Leili, please.
Okay, thank you so much. Hello, everyone. Good morning, good evening, good afternoon, wherever you are. Myself, Leili Seifi, Associate Professor at the University of Birjand, and Neda, my co-presenter, from Middle East and Islamic Studies librarian. We are going to, actually, I will be presenting this topic. Our topic is health information literacy of pregnant women in Iran, challenges and solutions. Before I start, I must explain that this is part of our granted project from Purdue University. So this is just like as a systematic review. We have done one phase. I'm going to share the result with you. Just the context that what is happening in Iran. Women in remote areas in Iran are least likely to receive adequate health care due to various health system and individual related factors such as poverty, distance, level of education, lack of information, awareness of health services and cultural practices. And the other factor is the percentage of rural pregnant women receiving parental care is only 20% of pregnant women in Sistan and Baluchistan, one of province in Iran. Another important factor that affects parental care is the low level of health literacy among pregnant women. Despite child marriage, as some of you may know, child marriage and teenage pregnancy being prevalent in Iran, there is a lack of information on the barriers that prevent rural women from accessing pregnancy-related health information. So for the improving of this health literacy among rural women in Iran, this was crucial that for the enhancing their awareness during pregnancy, we can provide some toolkit or like educational material. So that's the reason and main problem that we wanted to know that like in the first phase, what are the challenges faced by pregnant women in Iran according to the previous studies, and what are the solutions to improve the health information literacy of a pregnant woman in Iran? So our method was a systematic review. As I mentioned, we reviewed 20 articles from 2013 to 2022. And the population of our study was from Sanandaj, Bushehr, Tehran, Isfahan, Bojnord, Mashhad, Baluchistan, Bandar Abbas, and Isfahan and Bushehr. So this was our research population, means that from the previous. So what we found from previous studies, the results showed that the type of health literacy needs that this woman had, we come up with some categorization. So the first category was their educational needs, different educational needs. For example, reading prescription, they needed somebody to teach them how to read, or for example, reading lab results, health awareness, these were like some categories. Then access to health information, like for example, pregnancy care, good quality health information. Another category was pregnant information seeking needs that for example, they need sufficient nutrition. They need to know about these things, risks and diseases during pregnancy, movement and weight, and drug addiction and alcohol and some other factors. The other category was child care information seeking needs. Like for example, for newborn care, they need to know about this item. For example, infant nutrition and supplements, vaccination, and so on. And another factor was health infrastructure needs, like decision-making process in pregnancy, health decision, and application. Another category was source of health literacy information. We found that from previous studies, like media, online information resources, like majority of the sources that they used to use, printed information resources, social media, training classes, but very few, and health centers in case they had a health centers. But since most of them, they were living in rural area, this factor was really raw. And most of the way that they were like meeting their needs was oral communication from their friends, family, relatives, and so on. Another category is like the challenges they face during for accessing health literacy. There, again, we categorize these challenges like first challenges, educational infrastructure, due to lack of health centers, libraries, and also their own literacy, like lack of literacy. They had really this challenge. It was very important. And then economical and social barriers were like another important challenge for them. Low income in most families, special ethnic, because this person was like this group population were like Kurd, Baluch, and these are like minority ethnics in Iran. So that also another barrier for them. Cultural issues, in these areas really make them like lots of issues reaching to their, like, for example, needs, health literacy needs, lack of like company support. That was really, like a challenge for them. And that was like because of, for example, sometimes not accompanying support due to cultural issue or lots of work, or earning money. And then welfare infrastructure, not having, for example, parks or sidewalks suitable for walking, and etc. And healthcare infrastructure was another issue. And individual barriers like fear, stress, inactive lifestyle, aging. Sometimes, with aging, they used to like get pregnant, and language barriers, of course, because their language, like Baluch, Kurd, like it was different, and so they had a barrier. And we categorize like solutions for accessing health literacy. So improvement of educational infrastructure, for example, revisiting and simplifying educational materials, promoting communicational skills of mothers, developing a platform for training, pregnant women empowerment, that was very important, like increasing the level of their health literacy and like maternal health improvement programs. Another item was improvement health information awareness, improving health awareness, pregnancy and child awareness. And improvement of rural policies was very important, considering the rural approach to training programs and policy for illiterate population. Development of educational intervention, that is the main focus of our research, that we want to finally develop this intervention. So what we come out with this studies, that a majority of women had a low health literacy, limited information seeking behavior, like 50% of pregnant women suffer from insufficient health literacy. 75% have unfavorable information seeking behavior, and due to low income, and like education was the major problem, due to, as I mentioned, ethnic and social and population challenges. So some recommendations, but the result of this recommendation, we are going to develop intervention and conduct workshop in like some a very rural area in Iran as a next phase of our study. So to teach information seeking skills and empower pregnant women to seek health information, to provide oral and visual education in addition to written educational material in the form of posters, brochures, and pamphlets, and also to develop effective educational methods for women with limited reading and writing. That will be like considered in our toolkit. So this is like a kind of the first phase of our study. Just we wanted to share the result that actually we hope that with this study we can really help to this community in rural areas that, you know, for their needs. And I would like to acknowledge Institute for Information Literacy at Purdue for sponsoring this research. They have actually provided fund for us for like designing the toolkit and conducting the workshop in the rural areas. These are also our references, and I tried to just, you know, take my time. Thank you so much, everyone, for this great opportunity. And I'm also thankful to my co-researcher, Neda, for helping and working on together. Thank you so much, everyone.
Thanks, Neda. Are there questions in the audience or on Zoom? Okay, a lot of claps and thank yous on the Zoom. Thank you, Leili, very informative. Okay, yeah, a lot of kudos in the Zoom. Okay, I think we can take a little break before the next panel. Oh wait, I have a question. Are there some contradictions between medical and traditional advice? If feel free if that person wants to like speak up and or no, I think they'd have to be a panelist to join, but yeah.
You know, should I respond the question or just wait?
Yeah, you can respond the question.
Yeah, if I got the questions correctly, like they are asking between medical treatment and traditional way of, I'm not sure that like the exact question. If
Okay. Yeah. Well.
Okay.
Yeah, I think it's kind of like different kinds of medical advice or
yeah, you know, let me respond this question like this way, that in rural area, yeah.
Someone wrote, someone wrote midwife traditions versus more standard.
You know, in rural area, yes, I would say yes, because, you know, first of, the main reason is like not having medical center in the rural area, and the transportation to cities and like medical centers is very difficult sometimes, for example, at night, or like, you know, they even don't get the transportation to get, even if they have money also. So so that we have such a things in rural area, and they are using still, and yeah. So yeah, this is my answer. And the other thing is that the young age and like old age pregnancy is like very common between this rural area. In some cases, like they get pregnant in 12, 10, maybe, yeah, 9. Sometimes, I'm not sure about 9, but 10, I'm sure, like we have a statistic. And also old age. like getting the pregnancy. So this is also another issue, main issue.
Thanks, Leili. And then Justin had a question.
Hi, Leili. So good to see you, actually.
Thank you.
We interact a lot. I just had a question about, just because of my own experience, my wife she had a doula who came into the house and helped her emotionally with the pregnancy and everything. And actually, my third son was born on the kitchen floor, and the doula arrived in 15 minutes to catch the baby. So it's an incredible story. But anyway, I want to know if do Iranian women, when during their pregnancy, do they use doula services? This is the non-medical professionals who provide emotional support, and they know some training to be able to, with breathing and everything like that. Is that a common service in Iran?
Thank you so much for sharing your experience and also asking this great question. Not dual service, I wouldn't say. Instead, like we have like kind of traditional women, and they are experienced, but means that, like, for example, now it's forbidden, but they do like at home, but not the way that you are describing, It's not that kind of services in Iran, but instead in some rural area, some women, they come to home and like get help to that woman to give birth to child instead of going to admitting in the hospital or something like that. But that kind of experience, no, at all. Even in cities also, no.
Thanks, Leili. And then we had one more question in the chat. I'll read it for folks here. Pupak Amirazadi asked, are there possibilities to reach and inform affected locations on the move? Move means mobile to rural areas.
No, that is not possible.
Okay, all right. Well, thank you.
Yeah, sorry. I just wanted to add that, it's like this, especially in Baluchistan and the southeast, like rural part of southeast of Iran is the situation. And they give, like, for example, one woman nowadays may give, for example, 5 or 6 child. So the situation is really, really in very poor things, and they don't have anything in the area.
Okay. All right, great. Thank you, Leili. I think we can take a coffee break for 15 minutes and then regroup. Thanks.